Can you hear it? The pulse of our region. It's starting to sound like progress. It's happening here, and there, all around us. We're gaining momentum and catalyzing change. But it doesn't happen on its own. We need each other. Every person, every business, every organization, we all play a role. We're leading. We're collaborating. We're growing. Yeah, we've had some wins. But we still have work to do. We're leveraging our assets, investing in innovation, and creating opportunities for everyone here to share in this momentum. The pulse of our region is strong, it's steady, it's rhythmic. Can you hear it? Can you see it? Are you a part of it? Every beat represents the commitment, the drive, the determination that is uniquely Akron. Our progress is palpable, but we've only just begun. We're gaining traction and building something powerful, something together, something greater.
Good morning, everyone, and welcome to today's Leadership Dialogue, focused on the important issue of population health and the implications on business and the role of employers. Before we begin, I'd like to thank our presenting sponsors: Akron Beacon Journal Local IQ, the Akron Community Foundation, Browse McDowell, First Energy Corp, Key Bank, and Sumacare. I'd also like to thank our premier sponsors, including Cap Trust Financial Advisors, Gojo Industries, Harwick Standard Distribution Corp, J.W. Dodado Electric, Maynard Family Foundation, and the Goodyear Tire and Rubber Company. Today's topic is one that impacts each and every one of us. While hopefully health is something we've kept top of mind for ourselves and our families, the COVID-19 pandemic that hit earlier this year has solidified the tie between the health of our employees and the population, our businesses, and the economy. The COVID-19 pandemic reinforced the impact a healthy or unhealthy workforce can have on our businesses. It highlighted the way the health of our community can affect a regional or a national economy, and it reminded us about the importance of operating our businesses in a way that keeps our employees and our customers safe and healthy. As I reflect on the year's many lessons, I believe that the pandemic served as the highlight for existing issues that were underlying long before any of us heard the term COVID-19. For example, before COVID-19, systems were broken, people battled addiction and other health issues, systemic racism handicapped generations of minorities, and access to healthcare was a challenge faced by many. However, when the pandemic imposed a blunt force on our economy, our workforce, and our health, all of these pre-existing issues were magnified to the point of attention. It's not to say that the business community was unconcerned about employee health and well-being prior to the pandemic, but the attention paid to the issue was not nearly what it should be, and hopefully not what we'll see as we move forward. Many employers are now finding themselves in a position where the topic of employee well-being, mentally, physically, emotionally, is center stage. People are working from home, managing multiple new challenges, some new anxieties, and battling existing and emerging health issues. As a business community, our people are our most critical asset, and it's our responsibility to look out for their well-being, both for their health and for that of our businesses and the economy. A healthy workforce is critical for a healthy economy. Today's conversation will focus on 3 concurrent epidemics, all of which impact the business community in different ways. We'll talk about COVID-19, the opioid epidemic, and we'll also discuss systemic racism as a public health crisis. Each of these issues has real and potential negative implications on a business's ability to find and retain talent, control their operational costs, such as health insurance and workers' compensation. And they also pose threats to a business's ability to maximize the potential of its productivity, its opportunity, and profitability. Employers who make the health and well-being of their employees an intentional focus will find themselves better positioned for growth in all areas. Our goal in this conversation today is to reiterate the ties between employee health and business, unpack some of the most critical issues and the challenges, and provide resources to help employers advance their focus in this space. The topic is complex and multifaceted. Thankfully, we've got an impressive set of panelists with us today, each of whom brings a unique perspective to this important conversation. And in keeping with the importance of health, I'm pleased to introduce Bill Eppling, president of Sumacare, to introduce our panelists. Bill's new to Sumacare, but not new to the region or to significant leadership roles in the healthcare industry. Bill joined Sumacare as president in August of 2020, bringing more than 30 years of experience in healthcare delivery and managed care. Prior to joining Sumacare, Bill most recently served as the president of Envision RX Options in Twinsburg. He also previously served as president at WellCare of Ohio and president and CEO at Hometown Health Network. Bill's an impact player who's had uncanny success in each of his opportunities. I've enjoyed getting to know him as we work closely with Sumacare as our partner in developing our health benefit MIWA for our small and mid-sized businesses. Take it away, Bill.
Thanks, Steve. On behalf of Sumacare, I'm pleased to be here today for this discussion. At Sumacare, we place a concentrated effort on fostering a healthier community and guiding people to be the healthiest versions of themselves. When people are healthy and at their best, it creates positive benefits in all aspects of life. Population health is a dynamic and complex topic. There are so many factors that can affect it and just as many areas that are impacted by it. Today's focus on COVID-19, the opioid epidemic, and systemic racism as a public health crisis are all issues that are impacting our workforce, our businesses, and our economy in different ways. Understanding the state of these issues and the things we as a business community can do to promote the health and well-being of our workforce are core to our ability to move forward as a region. Thankfully today, we are fortunate to have an impressive set of experts on our panel for this discussion, and I'm excited to be able to introduce them today. Let's begin with Kyle Fee, Senior Policy Analyst in the Community Development Department of the Federal Reserve Bank of Cleveland. In this role, Kyle conducts applied research and outreach related to economic development, workforce development, neighborhood development, and economic geography in the 4th District. He holds a Bachelor of Science degree in Economics and Business Administration from John Carroll University. He received an MA in Urban Studies and Economic Development from Loyola University Chicago, and he's currently working on his dissertation at the Maxine Goodman Levin College of Urban Affairs at Cleveland State University. Next, we have Alicia Nelson with us this morning. Alicia is the Director of Recovery Ohio, an initiative designated within the Office of Governor Mike DeWine to fight off Ohio's public health crisis, focusing on mental health and addiction prevention, treatment, and recovery support services. Shortly after Recovery Ohio was established, Alicia worked with the governor to create the Minority Health Working Group to address behavioral health conditions in communities of color. Alicia also currently serves as the co-chair for Governor DeWine's COVID-19 Minority Health Strike Force. The strike force was established to address COVID-19 and its disproportionate impact on minority communities across Ohio. Before her time in the governor's office, Alicia served as the Director for Substance Use Policy Initiatives in the Ohio Attorney General's office. Prior to her state work, she worked for the Alcohol, Drug, and Mental Health Board of Franklin County. Next, I'd like to welcome Dr. Brent Policki, the Chief Health Officer at the Goodyear Tire and Rubber Company, a position he has held since 2011. His responsibilities in this role include global health strategy, providing leadership for Goodyear's medical clinics, fitness facilities, health benefits, health improvements, and wellness programs, employee assistance programs, and health-related emergencies. During his tenure, Goodyear received the platinum level of the Best Employers for Healthy Lifestyles Award from the National Business Group on Health. Prior to his current role, he was the Corporate Medical Director at Pitney Bowes, overseeing all health-related issues for the organization, including the Pitney Bowes award-winning corporate clinics, wellness programs, and absence management department. During his career, he worked in a private medical practice as well as the emergency department. He attended college and medical school at St. Louis University and completed a combined residency in internal medicine and pediatrics from Bridgeport Hospital and Yale University. He also completed the Master of Medical Management business degree from the University of Southern California. Finally, I'd like to welcome Summit County Health Commissioner Donna Skoda. Donna has worked in community-based public health programs for over 25 years. Her current responsibilities include overall management of the health district, including the assessment and epidemiological components within the health district, data and information systems, and general strategic planning for the health district in the community. She has served as staff for the Summit 2020, a quality of life project from the beginning, and continues to assist with the local management. Previously, Ms. Skoda was employed in Cuyahoga County for 15 years, implementing community-based programs in the areas of nutrition and many other areas of public health, the community, and within hospital systems. She's a registered licensed dietitian with a master's degree in public health and nutrition from Case Western Reserve University. Our moderator this morning will be Steve Millard, President and CEO of the Greater Acton Chamber. With over 25 years of experience working with employers in areas like small business health insurance and employee wellness, Steve understands the impact that employee health and well-being can have on the success of a business. Given the events of this year, this morning's topic is not only relevant, but essential for us as a business community. We're fortunate to have this impressive set of leaders, and I'm looking forward to the conversation that is about to unfold. With that, please take it away, Steve.
Well, good morning. Good morning to my esteemed panelists, Kyle and Alicia, Donna, Brent. If you guys can turn your videos on as well, that'd be great. So as we sit here on, I guess, Thursday morning, we are in the final stages of our election. We are continuing to see lots of different issues related to health in our community. And I guess I'm going to do what most people do when we talk about this. I'm going to start with Donna Skoda and ask Commissioner Skoda to start out and say, where are we right now, Donna, with COVID-19 in our community as it relates to maybe other counties in the state and maybe even other states? Give us a sense of where we sit right now.
All right, thank you. Good morning, Steve, and good morning to all of my other panelists. I want to start by saying that I think we are in the middle of a surge. We're seeing it climb. We have currently in Summit County about 8,000 cases. The surge is continuing across the entire state. There are very few counties. I believe there are 56 right now in the red category, according to the governor's alerting system, meaning that they have at least 4 to 5 of those indicators they have met. The concern we all have currently is that we're seeing it also spikes in congregate living settings again. And because when there is wide community spread, you are going to see the same reflected in individuals that live together in particularly high-risk situations. The elderly, the developmentally disabled, anyone who has any underlying health conditions. So we are concerned that we are seeing these spikes. However, we also know that our hospitalizations are going up. And the concern for this, Steve, is that we now know that this is the time of year when people get sick anyway and end up in the hospital. And it may not be COVID-19. There's lots of other bugs that circulate. Coronaviruses love colder weather and they circulate well. So we could have any number of situations. So it's imperative that we all do what we can do by wearing a mask, staying 6 feet apart, limiting our social interactions, not having folks over to our houses in large groups because we let our guards down, and then really trying to keep our kids in schools and our businesses open. But it's going to take all of us because we have to stop the spread so that our hospitals do not become overwhelmed.
Thank you. And I think that's one of the things that employers need to sort of keep in mind. We've heard from the governor almost every day in his press conferences that, you know, in our employer locations, in our schools, we're seeing, you know, lots of processes in place that help. It's that social interaction, that after hours interaction, those weekend things, the Halloween party, maybe the Thanksgiving event, those things that we're most worried about. You know, Dr. Polecki, in your role at Goodyear, you are working at that intersection of employee health and business, and not only had to react to what was going on back in March, but also sort of the ongoing work that you're doing. Talk a little about what Goodyear has been doing in this space and how you've adapted in this environment to keep your employees safe and healthy. Did we lose him? I think we may have lost. Dr. Polecki is having some connectivity issues there, so I'm going to wait till we get him back. And when you're back, Brent, just let us know. But Lisa, let me move to you and talk about a little bit, you know, COVID is one thing we're focused a lot on. As we dealt with that, one of the other major health crises that we have been dealing with in our state for a while now, and, you know, Summit County as well, is this opioids issue. You oversee Recovery Ohio, focusing on mental health, addiction prevention, treatment, recovery support. We haven't heard a lot about the opioid epidemic this year, given all the news and focus on COVID. But where are we with that right now? Are we seeing a resurgence? Have we sort of lost the gains that we've made? Give us a sense of where you think we are there.
Absolutely, and thank you for having me here this morning. I'm glad to be virtually home in Akron, Ohio. My mother still works at Goodyear, so really feel connected to the work that's happening there. And I wholeheartedly agree with you that we need to be focused on population health. I know we have a pandemic before us, but we certainly didn't lose sight of the epidemic. And I know that there are many people still on the front lines of that epidemic around addiction and mental health who are working hard every day to address what we see in our numbers as a surge of need. And so one of the things that I love to do is just quickly talk a little bit about what we're seeing in Ohio. I know that we've had, and we were really hopeful for the gains we made in 2018. We saw a 22% decrease in overdose deaths. And unfortunately, that decrease didn't sustain. And luckily, today, you guys will get, and we will be releasing the 2019 drug overdose reports for the Department of Health, along with our reports from our partners in the anecdotal work that they do through our OSAM reports from the Mental Health and Addiction Services Board. So stay tuned for those. But what I'll tell you about 2020 is that May was the worst month on record for Ohio's history. Wow. June didn't look very much better. It is hard to fathom the numbers that we are seeing. And I want to make sure that we continue to have conversations about how we can keep people healthy amidst a pandemic, in an epidemic, as everyone is also starting to feel feelings of stress and anxiety at this time too. We got to make sure we have our eye on our mental health. And that's true for our employees, that's true for everyone in Ohio. And so thinking about ways that we can be supportive, understand that isolation has an impact on our mental health. Isolation and distancing is necessary in a lot of cases in this pandemic. But what can we do as partners to keep people connected, to keep their recovery support systems intact so we don't see continuous relapse and overdose in the numbers that we have been seeing so far? And that's what we're thinking about at the state, and really you will really start to see in the governor's announcements yesterday. We are ramping our efforts up, making those more connected to the COVID pandemic response. They've been happening in the background, but we really felt like we needed to be more visible and transparent about what we're doing new and different around these issues, and look forward to partnering with all of you to really make a dent and stop these numbers now. So it's just, it's not a trend that continues.
Thanks, Alicia. I think we got Brent back. So Brent, the question that I asked before we lost you, unfortunately, was around as Goodyear thinks about all these intersections of employee and health and productivity and those kinds of things. You've had to respond not only to opioids along the way, but also to COVID-19 earlier in the year, not only locally here, but globally. Talk about what Goodyear did to adapt in that environment and how you're kind of focusing on these issues right now. You're on mute, Dr. Plucky.
Myself, I apologize.
No worries.
You got it now?
Got it.
Okay. Yeah. So we actually we're involved in this since January.
Dr. Polecki, we've lost you again. You're again back on mute.
I'm sorry about this.
There you go. You're good now. Sorry, we had you. I know you got disconnected there, and we're trying to get you all situated again. So apologize for the stress we're putting you under here. So go ahead.
Yeah. So we're working on this since January, and we had people in China, so had some awareness that things were coming, and we didn't know exactly where it was going to go. But one of the most important things was to try to understand where could you get resources, where could you then get the the interaction with other folks and what were the tools that you needed. So one of the first things we did was really work with our public health department. Donna Skoda and the whole team was phenomenal. Working with my other colleagues in other corporations, that was one of the things that we did. But also it was trying to get in front of folks with a communication plan to be certain that they knew what was going on, what we didn't know, what we did know, and then try to provide a level, calm voice, because we weren't getting a lot of guidance from some of the people that we should have been. And so we provided that. And I will tell you that what Alyssa had to say around emotional health really has been right on. We're seeing a huge increase in the number of people who are seeking some support. There is, fortunately for us, we have a global employee assistance program, and we're seeing a lot of people reaching out for that. So one of the things I've done is really to blog twice a week and include things that will help support people emotionally, some of the tools that they need, and try to really help people with whatever ways and get the knowledge out to them in most ways we could.
Yeah, and I think that role that you play and a lot of your colleagues play across the country inside of employer environments, dealing with employees, is an interesting one, and one I'm sure is super valuable as we go through these kinds of issues as companies. You know, Kyle, as we think about the economic impact of these things, there's been a little bit written on the economic impact of COVID so far. We're still understanding that. But, you know, you've done some work on the economic impact of opioids as another health intersection with business. Can you talk a little about what you learned about that and the impact that things like opioids have on businesses and the economy?
Of course, Steve. Thanks, and good morning, everybody. No, I think with most economic impact studies, they're really a function of kind of the inputs that you put into them. So there's numerous studies out there that have estimates in the billions. The Council for Economic Advisors uses a kind of a different set of assumptions that I think does a really good job of capturing the true impact. But and then the true impact for that is about $500 billion in 1 year. So sizable, significant amounts that we're talking about. But what it doesn't really also factor in that I think should be considered is future impacts. Most importantly, future human capital development, as well as kind of opportunity costs of having to shift around resources to address and deal with some of the fallout. So this economic impacts are in the billions and very, very high and very important for us to think about.
Well, I think, you know, in the broad economy, you've kind of addressed it broadly there. Dr. Polecki, as you think about the impacts of employee health specifically on your business and the bottom line of Goodyear, how do you tie those things together? I guess, how do you sort of make the case for employee health in the business and kind of think about how you proactively address measures that impact it?
Yeah, I think it was a faulty assumption in the past that we didn't believe that employee health was part of the success of the economy. And so what we're now learning is that by some of the challenges to people's underlying health, is we're seeing around overweight, obesity, hypertension, diabetes, those are actually leading into some of the challenges for us over time. So why it's important is because it increases our healthcare costs. So even if you don't have to pay for healthcare directly, it does increase the entire cost of health.
Right.
So and then thirdly, there's a thing called presenteeism. So I can actually ask, I'm being challenged by the fact that I am only thinking about my backache and my and how much it hurts and how I need to get care. And so one of the things that becomes helpful is for us to realize that that's a distraction and that we need to be able to help people to get well and to not have that distraction so I can be more effective at work and be better at what I'm doing and be more focused.
And I think that's one of the things that we don't really know how to calculate. I know a number of years ago, this idea of presenteeism was something that people said was a myth. You're really not getting value from people's lack of productivity, but just, I think a lot of us recognize, especially in some generations, that if you're dealing with childcare issues or dealing with parental issues or you're dealing with your own health issues and anxieties, all those things play into the way you show up at work and the way that you can actually be effective. As you've sort of watched employers, Commissioner Skoda, in terms of their response to COVID, their response to opioids, those kinds of things, what are some of the best practices you're seeing from employers as they sort of work to respond to these employee health issues? And as you see it from the public sector, what's the role of business in this from your perspective?
Okay, I think, Steve, when you think about the business response, I think first it's got to be a hats off, and I'll take COVID first, and then we'll talk about the opiate crisis. I think for the COVID response, the businesses have stepped up and I think have tried to be as responsive as they humanly can be, having been dropped into this alternate universe overnight.
Yeah.
And so it's difficult to shut down your business, to think about your employees at home, try to get them working from home, thinking about socially distancing, wearing a mask, and they've done all of that. I can say overwhelmingly that the complaints are starting to drop off. People are feeling safe in their work environments. And I think they're really doing a good job at trying to keep people safe. I think in regards to the opiate crisis, I don't know if we really understood it well enough from an employer perspective, because you always think, no, it can't be, it's not my employee, it's not I. But actually, when you look at some of the research in the literature, a lot of employee health plans paid for a lot of the opioid. They paid for the crisis, they paid for the money, they paid for the number of employees getting these days off, any number of issues, okay? So I think employers have done the best. I think what we see in Summit County was when you make an employer aware of an issue, then they respond appropriately. I do think they have a role in both of these crises, because what we're seeing is a very different way of life bestowed upon us. And, we were heavily dependent on daycare. We were heavily dependent on schools to keep our children during the day. And now that we don't have those two things, we realize how fragile our social system was to support families. And then you layer on top of that the comments Alicia made. People are struggling. They are stressed. They feel awful. They have to choose between working and having a family. They're trying to get their kids through school. They understand their children are doing poorly. I think employers have an inherent responsibility, if they want a productive workforce, to let employees address those issues. And I know some businesses can't let people go home. I mean, we're public health, we work 7 days a week, we can't go home. But I mean, as much as you can do to support your employees, and I think, Brent had mentioned the idea they have a global EAP. I know the state of Ohio set up the care line. I sent that to all of our employees yesterday saying, hey, listen, take a few minutes, inhale, exhale, and breathe. We need to do this. So I do think there's a huge role. And I think if we all realize we're in this together, and healthy employees mean a healthier community, means a healthier workforce, then I think we'll get through it.
So I'd love to get that link to the care line up on the chat here so that people can see that, because it sounds like a resource even for those smaller businesses that might be able to connect people to help. If you don't have the ability of having the EAP in your business, somebody to reach out to and talk to is helpful. So if we can get that up, that would be great. Alicia, just same kind of question for you. In your experience, the role of employers as it relates to addressing the issue of addiction. What are you seeing employers do that sort of can be helpful or work?
Absolutely. Completely agree with the commissioner on how a healthy community makes for a healthy workforce, makes for a thriving economy. And I think that these all are issues that are tied together. And for people with mental health and substance use disorders, meaningful employment, it really plays a vital role in their recovery. And, when we look at how many and the prevalence of what we're seeing in Ohio, we know that no employer is immune to and most likely has someone who is struggling with a mental health or substance use disorder issue. And so the first step in recognizing that is to make these things available, have these conversations, and put together drug-free workplace policies that are understanding of recovery, that really speak to inclusion, because the more that we can get people back ingrained in our communities, healthy homes, healthy lifestyles, the more we can have that thriving, productive workforce that we all strive to have. And so, all of these things really come together. I think when Kyle mentioned the economy, I thought about the work that we're doing. And I think that this is important for you all to hear around personal finance. What we've seen is parents who have drained their retirement accounts, who have had vested interest in businesses and their employers through different programs, stock options, who are trying to save their children. And in that we are really going to work on in the coming year with the Department of Commerce to put out educational messages, and would love to get that information over to you all so you can share that with your employees, to make sure that they know how to safely get folks into treatment that doesn't mean a devastation to their personal finance accounts, as much as possible. And so we really want to have those conversations. I couldn't help but bring that up. But we're seeing a lot of conversations on the healthcare side too, understanding that this is a balance. This isn't just what you all need to do. We need to do better at working with you as business communities, and understand your language, understand what drives your businesses to be more supportive as a state to you. And so we've been having a lot of conversations about just understanding that when folks are entering into treatment, we talk immediately about home, we talk immediately about community, we talk immediately about the workforce and where they like to see themselves, so that they can also more quickly get re-engaged in with you, and connected to that employer and productivity that we'd like to see. There are a number of resources out there. I know I was looking, I'm so happy to see the 2020 priorities for the Greater Akron Chamber of Commerce include these conversations. I know stay connected to Steve and his team as they continue to provide information. And then we also have groups at the state level who are working to provide information, and will be soon, hopefully this year, rolling out a new toolkit with you and for you. So please stay tuned for that and check out the Recovery Ohio website for connections to other groups.
Those employer toolkits are super valuable, because for employers, we're thinking about so many different things. Being able to have a comprehensive set of materials and resources to make easily available to our employees is key. And we appreciate those resources very much. Kyle, as you think about the implications on workforce of some of these things, opioids and others, what are some of the trends and indicators that you see that sort of are leading to the increase in addictions? What industries are sort of suffering the most from this, from your research?
Sure. Well, I think there's a couple of indicators, and they kind of are going in both directions, if you will, and let me explain. First, I think a leading indicator is opioid prescriptions, whether that be related to surgery or injury-related things. And then alternatively, there's this kind of hypothesis that's been produced by a Nobel Prize-winning Angus Deaton around the deaths of despair. And this kind of concept is founded on the idea that poor economic prospects are causing people to think about or pushing people into substance abuse and addiction, and even suicide in some cases. So as far as leading indicators into addiction, it could go both ways, both the prevalence of drugs to abuse, but also kind of the economic opportunities that someone may have going forward. With that said, I think naturally you think about industries that have been struggling for several years, for probably decades now, especially in Ohio, thinking of kind of routine, repetitive manual labor occupations in the manufacturing industry, the construction industry. We've heard a lot of anecdotal evidence related to people having difficulties coming back into construction because you're traditionally working with a crew, and your crew does a hard day's work of labor, and you may go out for a post-work beer or something like that, that eventually kind of leads into old habits, for example. We're also seeing the service industry struggle with opioid-related layoffs and challenges, something that's not new to the service industry, but is also being amplified with the COVID-19 pandemic as well.
And the way I understand how some of this works is, in these industries, folks might have a higher incidence or a higher issue with on-the-job injuries, those kinds of things, which lead to sort of a fix, right? Surgery or something has to be done to sort of deal with the pain, and that just eventually leads into this cycle that folks just can't get off the opioids. That's, Alicia, how I understand that sort of kind of get you there, right? So it's not necessarily just an issue for people or for rich people or for white people or black people, but it's something that is just kind of prevalent across these different industries where people sort of have an injury and kind of go from there. Is that right?
That's definitely one of the factors, and that's what we saw early on in that first wave with prescription connectivity. I think that there's a lot now to that, plus the grief and neglect that people are feeling, the emotional distress that people are feeling from dealing with this pandemic over time too. That is also a key factor in what we're seeing in terms of that onset of dependence to drugs.
So
yeah, I'd like to jump on that too, if I could. The former Surgeon General Vivek Murthy actually just published a book and really talks about loneliness and the pervasiveness of loneliness in our society right now. And it happens at every level. It doesn't mean that you have to be isolated as an older person who lives alone. It actually can be the CEO of a company. It can be a member of Congress. It can be any number of folks who are feeling lonely and disconnected. And so that is one of the big challenges, and that's where people are self-medicating, trying to find a relief from some of the pain, and then getting involved with some of the challenges that are going on. So connection becomes so important to us. The ability to reach people, the ability to feel like you're part of something larger, to have a purpose in life, those are all important pieces that allow us to have strong connections and not have distractions all the time, and really be able to make a difference for people and try to bring them out in our community out of some of these challenges.
Yeah, it's such an important point, and you mentioned something unexpected there, Brent, around this idea of it doesn't matter where you are in your organization, that loneliness and disconnectedness can set in. I was talking to a friend yesterday who said, we were talking about the impact of this, and I'm one of those people who likes to kind of walk around and connect with folks in the office, and not being able to do that is a very different way of having to manage and lead, and it does disconnect you. I want to turn to the topic. We've talked a lot about opioids and COVID. I want to talk a little bit about systemic racism. So, earlier this year, Commissioner Skoda, Summit County declared systemic racism as a public health crisis. And I want to get a sense of what drove you to that and how those things connect, because some people would say that, well, I don't get it. I don't get how sort of racism and health work together. And that's just kind of the way things are. Talk about that. Make the connection for folks to help understand why you made the move that you did as a county.
Okay. Again, I think we tend to think about systemic racism as just a one thing. Like, you don't like minorities. You may have said some inappropriate racial-ish slurs. I mean, we tend to think of it like in those terms, but really you need to think about systemic racism as a system. Public health is a system. It includes the hospitals, it includes employers, it includes everybody, and we want everybody to work together. So when you think about systemic racism, the easiest way that I try to explain it to folks is, think about a little one who is born to a single mom who doesn't have the resources they need. There aren't a lot of social supports in place. There are policies that perhaps have been created that keep her separate from her other family members. I mean, may have not allowed her to have adequate resources to have a standard of living, may not have adequate resources to have a house to live in. So that little one then grows up, it starts to grow up and starts to go to school. May have had the opportunity for a preschool, may not have. That little one starts going to school. They go to a school district where it may, in fact, not have the resources that other districts have. You know, every kid, every little one needs to read by the 3rd grade. If you don't read by the 3rd grade, you stop learning, because after that, you have to read to learn. So it is critical that we get these children at 3rd grade reading levels, and that we understand that it starts when they're very little. So then that little one grows up and they struggle. They struggle in school, they have difficulties, they blame it on everything else in the world, but the little one is struggling, okay? So what happens then? They leave high school, they don't have post-secondary training, then they don't get a job, or they get a job that doesn't pay enough to take care of them or their families they may want. They then end up having no health insurance, because we know if you don't have a college degree, you know, chances are you're not going to have health insurance. And if you don't have a job, you're not going to have health insurance in this country. And so then it just continues. You immediately get behind and you stay behind. And we all, I get very frustrated when I hear, oh, anybody can be anything. That isn't necessarily true if you don't start out with the right supports, and if you don't help folks be successful. So then what happens if you don't have a job and you don't have adequate housing and you don't have access to healthy foods? Your health suffers. And I know I fall off the wagon as a health commissioner. I'm supposed to be telling people to check their cholesterol. So I'm supposed to be telling people that. But let me tell you what I'm going to tell them. You give somebody a job, you'll give them an opportunity to have better health. You give somebody education, they'll have a better opportunity for health. And we have to start thinking like that. We have to prepare people to take care of themselves. I am 100% convinced, Steve, people are more similar than different. Everybody wants the same thing. I have never met a mother who woke up and said, you know, today I'm going to be the worst dang mother on the earth. It isn't what happens. Right. People want the same things. It's just, do you have the opportunity to get it?
You know, it's interesting because you said something there that I think is important to put your hands around. Oftentimes we cast racism, systemic racism, in terms of somebody actively doing something wrong to somebody, or some diabolical scheme to keep people down. And at some levels, some folks may view it that way, but I think what you're sort of saying is it's really a series of things that build upon each other throughout somebody's life that put them where they are at 20 or 30 or 40. That might have been different if the path was different. So just an understanding of that, of how those things connect, is pretty important as we try to solve this.
Yes, it's extremely important that we have to connect those dots, because we want everybody to be successful. And I'm certainly not going so arrogant to push the way I want to live on everyone, but you should have the opportunity to live how you want and have access to those resources.
So one of the most important things that you can do as in the development of a child is to read to them in the first 3 years. If you read to that child, it doesn't matter what your socioeconomic level is, that child will have a better IQ and actually have better outcomes over life. And one of the challenges that Commissioner Skoda just mentioned was that many single moms won't have the time to be reading to their child over time, and that actually heightens some of the challenges. But it is a very important thing in the neurodevelopment of a child to help them in the growth and their overall success, is to read to them every day.
Yep. You know, it's interesting, Dr. Pilecki, as you sort of do your work, this shows up then in the workplace, right? So when you think about as a physician and somebody who oversees employee health at Goodyear, do you see disparities in outcomes and health-related behaviors among employees of different backgrounds, different cultures, different races?
So one of the things we try to do is to be equal across our associates and try to provide them an equal standing. However, not everybody comes from the same place. Right. So one of the best ways of figuring out a person's health is by looking at their zip code. Commissioner Skoda can speak to this much more clearly than I can, but where a person lives actually talks about some of the outcomes that they're going to have around healthcare and some of the health disparities that they have as well. Donna, I'll turn it over to you on that piece.
Yeah, I mean, what we find, and Brent is referencing, is that individuals typically who are living in particular zip codes live there because of economic conditions. The rent may be more affordable, they may live with in-laws, relatives, whomever. But you're seeing folks live together in a zip code because of need. Nobody, and a lot of them are forced. I mean, in Summit County, you have to make at least $15 an hour to afford to rent a place. A mom with a couple of kids working a $10 an hour job can't even find a place to rent. The base rent is about $500.
Wow.
So, you have to think about what happens to people. You're in substandard housing, you're living in a very crowded condition. If you can find a place, you may or may not, as Brent alluded to, you're probably at that point working 2 jobs trying to stay alive. Your mom or your dad or some family member might be helping you out with the kids. I mean, it really becomes a very difficult scenario because you are kind of caught in that, and it's hard to get out of that unless you have a lot of social supports.
So, Alicia, how does this show up then from your perspective? I mean, you've been looking closely at COVID and how it maybe has been disproportionately impactful in different communities. You've also seen that in the addiction and recovery world. Talk a little bit about what you're seeing there from the work you're doing with your team.
I could say so much. I just really appreciate the words that have been said. I'm really excited to hear this conversation. For me, it's shown up in a number of ways, and when I think about what was just said, not only around education, but physical environment and how that plays a role in asthma rates and what our air quality looks like in our communities in those zip codes. And businesses play a role in that. And we have to understand our partnership, and we need to build better business community partnerships and understanding the health of the community and where our businesses reside. I think that for us, what that means at the state level is that we need to be bringing our departments together. Our Department of EPA it has not really done a great job connecting with the Department of Health and looking at those zip codes so we can bring awareness to some of these issues that cause asthma or other undesirable health outcomes for communities of color. And so we are looking at those things now and hope to, through our work, through our commitments, understanding that racism is a crisis, public health crisis, it is really understanding how we can connect our data together, our Department of Transportation with our Mental Health and Addiction Services Department, our Department of Bureau and Workers' Compensation. I mean, we see the disparities within these numbers, and we have to go deep enough in these numbers to understand where they are. I mean, when we look at our workforce, looking broadly at, I do have a diverse workforce. You may feel comfort in looking at those numbers broadly, but within your divisions, do you have diversity? And that's what we found in the Department of Rehabilitation and Correction. Yeah, we have diversity within our employee system, but where is that diversity? Is it in the healthcare realm for the Department of Rehabilitation and Correction, or is it at the lower levels where it's janitorial or something else? We need to move people up in these systems. So I could talk all day about how we are looking at this in a holistic way. We hope to be partners. We hope to be an example for us as a business, Ohio as a business, in bringing these conversations to light and really partnering in ways, in creative ways to address some of these issues long term.
So Kyle, I know you want to get
Steve,
into this. I could tell you've got some things you want to say here. So
yeah, just to put some numbers on kind of the context, there are zip codes that are just west of downtown Akron that have life expectancies of 68 years. And you go just a few miles north and it's 80 years. So it's significant and it's real. And it's, we're not talking about long distances that are having these tough disparities.
There's a lot of work on economic mobility and the idea that if you're born in one of these zip codes, your ability to sort of, get to the next level is so much more challenged than for others just miles away. And I think that's something we all need to be cognizant of. Kyle, just pick up on sort of, so economic impact, as you were talking there, what do we know about the economic impact of race on businesses? So, for example, I've read a lot, seen a lot about the impact of COVID on Black-owned businesses versus white businesses. Talk about that for a little bit.
Sure. So I think first of all, we're seeing kind of disproportionate impacts on minority businesses. And it's kind of largely because they were just in different situations as non-minority owned businesses going into COVID. According to a study from the Atlanta Federal Reserve Bank, on average, minority owned small businesses generally have lower revenues than non-minority firms. So for example, roughly 50% of Black owned firms earn less than $100,000 annually, compared to 18% of white-owned firms report yearly revenues of less than $100,000. So there's kind of less revenue that you're seeing, but you're also seeing minority-owned firms and small businesses likely at greater risk of financial distress. And when we say financial distress, we mean that the business owner is likely going to be tapping into their own personal resources or funds in response to some challenging business conditions. So when we kind of hit COVID, we have lower revenues for minority-owned firms. They're more likely to be financially distressed. So some numbers around financial distress is 60% of Black-owned firms kind of fall in this category compared to 30 overall, so double of what you see across wide. And then once we hit COVID, we've learned a couple things through some surveys that we've done. One is that minority-owned firms generally are less optimistic about the future and kind of prolonged survival as the pandemic rolls on. And we also see that minority-owned businesses kind of disproportionately fall into those industries and occupations that have been hardest hit by the pandemic. So
places where there's more consumer contact or more sort of need to be on the front lines.
Exactly, more of the service type industries that again revolve around that interaction with the public to kind of conduct business.
Yeah, and I think that's one of the things that we're seeing, even in the grant program that we ran with Summit County, as we think about just the economics of a lot of our very small businesses, especially our Black-owned businesses that are in the personal service industry. They weren't ready for this, and they're having a harder time getting going again because, again, contact is one of those things that is a little different for a back-office professional services firm than somebody who's sort of selling goods and services or, cutting hair or something like that. So
yeah. And then another thing too that we were kind of digging into is obviously access to credit has been a kind of a challenge for people of color and minorities. But we're kind of really now starting to see that access to the PPP program for the federal government may have not been equal across all populations as well. So just those types of things that are systemic issues that kind of continue to surface and continue to exacerbate the disparities that we're seeing.
So, one of the things that I'd like to get into as we sort of get close to finishing up here is, so there may be some employers, there may be some folks who are sort of listening or like, that's might not be my issue, or, it's unfortunate these employees have to deal with these things, but, I provide the job, they've got to figure out the rest of it, et cetera. But I think we have learned a lot as employers in this process about things that are possible, right? I mean, I've talked to a lot of employers in the past around how, well, it's not possible for me to give people flexibility around their work hours. All of a sudden it's possible, right? Because we have to make it happen. So what are some of the things, maybe, Donna, that you've seen from employers in terms of good ways they've started to address these, or things that you're hoping might stick as we go forward past this current period of time?
Okay. Yeah, I think you're right that employers had to get extremely creative. I think now, we didn't think about folks working at home, and now we do. It's pretty common. It's more individuals are at home than ever. I hope that sticks for some. I mean, some it works really well, others don't like it. So I think maybe folks should have the options to work at home or not. I've heard both sides of this, the coin. Some people are glad they got to go home, others are not. And so it depends on what the person needs but what their home situation is like.
Right.
And so I think that sticks. I also think that we need to be flexible with these children. We literally have a society that counted on daycare and schools to keep our children. We have to realize that our employees still have the responsibility of their kids, even when they're in daycare and they're in schools. I hope more of us, if they become more flexible, maybe you can't afford to give huge sick time policies to your families, but if you can give them something that allows them to be off and not lose pay, I mean, that's would be very helpful. Now I've been in a public system most of my life, and that's not been as much of an issue because we have very robust sick and vacation times. But I think for a lot of individuals, not having any time and having to choose between going to work and not eating that week isn't where we want people to be. And so I think looking at the human element of what it takes. I never had children, but I can tell you right now, I've worked with plenty of people who have, and I don't know how they do it.
Right.
I don't know how they even get to work some days, having to juggle children, schools, you name it. It's tough. And so I think we have to be very, very sensitive to those kids, regardless whose kids they are our future. And we need to make sure those little ones grow up as best they humanly can.
That's such an important point as we think about that. We think about, I've got kids, they're older, and I think some of the unsung heroes of this period of time on our team have been the folks who are trying to simultaneously connect with their, peers during a Zoom meeting and managing the child on their lap or the homeschooling on the side. So I think we've all gotten an education in those pressures in a way that some of us maybe haven't thought about in a number of years. So I think that's been an interesting byproduct here. Brent, as you think about what Goodyear's been doing to keep a pulse, everybody talks about staying connected to your employees, making sure, I think Alicia talked earlier about the mental anxiety side of this. What are you doing at Goodyear to keep a pulse on how folks are doing? What are you doing with your managers to help them consider that and think about that?
Yeah, one of the things we're trying to do is to make certain that our managers are also having a time to recharge, just like your cell phone. Everybody needs to take a bit of time away and step aside. So I think it's extremely important for it to work right, for you to be able to allow folks the time to recharge and to give the expectation that people take their vacations and the attributed time and really work towards trying to support people with regard to their overall health and well-being. Now, one thing that a lot of people who aren't in large corporations often think, well, you're a huge corporation, you can throw all kinds of money and all types of issues at this. But there are tools and resources available for companies of every size, from a mom and pop shop with 2 people all the way up to a multinational corporation. And it really helps to determine how are you helping your employees to become healthy and engaged and well. And there's a tool out there called the CDC, from the Centers for Disease Control, the CDC Worksite Health Scorecard. And this tool actually goes across about 23 different components that show and help a person and a company to build a healthy environment for their employees. And you create a score. It's only for yourself, and it gives you some ideas about how to improve your score, because by doing so, it has been proven through research that those measures, like putting up information about the signs and symptoms of a heart attack or stroke, or trying to move people towards better decisions when they're at the vending machine. Those types of things make a difference for people in the long term over their overall health, well-being, and ability to remain sustained and resilient through really difficult times. Hopefully you guys will be able to post that CDC link on there for us, because I think it's a really important thing for folks.
We'll put that up there. And I guess that takes us to sort of, you've heard a lot today about these different areas, COVID, opioids, systemic racism. I'd love each of you to sort of provide your thoughts on the kind of resources that are available. Brent, you just mentioned one. Can you talk about other business resources that are available to employers if they want to get a little bit more into this piece around health?
Absolutely. So several years ago, we as a group of employers and medical directors in the community got together and said, hey, what can we do to make our community healthier? And we all recognized that one of the best places to do this was through the workplace. So we gathered and we created a group called the Employers for Health Consortium. The hospitals are part of this, the health department, the Akron Chamber, large corporations, small corporations are all part of this. And we are working to build collaboration amongst each other and provide resources that are there. So there's actually a website that is through the Summit County Public Health Department's website. It's called Employers for Health Consortium. And it is a resource that allows companies to get together on a regular basis, ask questions. We've done it multiple times through the COVID issues. And we are identifying what are resources that people can tap into that will be helpful. So one of the things that we're looking at right now is what are the mental health resources that people can tap into as corporations or as companies to help their employees through these processes.
Okay. Other resources, Donna or Alicia, that you'd point businesses to?
I can jump in and just talk about two that haven't been mentioned today. One is the Ohio Chamber of Commerce did partner with a number of folks at the state level to create the current toolkits that are available. Those are out now and available to anyone who'd like to get that information. And we're working on a revamp of that that I mentioned earlier that will be out soon. The second is a connection to working partners. I'm not sure if any of you have heard of this group, but we'll make sure you guys have the link. They offer tools, and we have partnered with them at different state agencies to create more information for employers that could be helpful.
Awesome. Great. And we'll make sure we get those resources out to folks afterwards. Go ahead, Donna. So you had something.
I was just going to say, often we get called at the health department if folks have questions about compliance or complaints. You're welcome to call us. We often have questions around environmental health concerns and issues around safety in buildings. I would encourage that you can call us for that. We also often refer folks to the CDC website that has worksite wellness information available to it, the state of Ohio as well. There's worksite wellness information available. And of course, I can't say enough good about Brent's work with the Employer Health Consortium. It's done, I think I've heard a lot of really positive comments from employers. It doesn't have to be rocket science. It doesn't have to cost a lot of money. Even just having a designated breastfeeding room in your business encourages women to be able to say that it's supported in the work environment. So, I mean, there's just even little things you can do that can really make a huge difference in your employees' health.
It's helpful. Thank you, Donna. And I think, you know, one of the things I want to remind folks of too is that your county's health department, the state's resources, the first instinct I've seen through COVID for your team, Commissioner Skoda, but also the others, is to help, is to provide information and resources, to provide support. The first reflex isn't sort of to fine or to sanction or to drag somebody, you know, take somebody's permit away. And I think that's something that employers sometimes worry about calling and asking the question because they feel like they're going to get targeted. But we appreciate the help first mentality that you've brought to this. Employers have gotten many supports and warnings along the way. Fortunately, there hasn't been a whole lot of sanction action required because folks get it and they want to do the right things. So as we have turned to a couple questions that we have. If you have questions, we've got a Q&A and a chat area on the webinar here, so you can drop them in. One of the questions is probably an obvious one that you expected, Commissioner, that was coming at is sort of this idea of given where we are in our numbers on COVID, do we see statewide restrictions coming back? And if so, is there a specific threshold? And maybe between you and Alicia, you guys can answer what you know about that at this point.
Yeah, unfortunately, I can't really predict what would happen at a statewide level. I don't know. I have, and I feel as though being honest is probably the best way, right? I have great concern over both ways. I mean, if you shut things down again, then we're right back where we started from. We have to learn to deal with it again. COVID's here for a while. COVID's a circulating, nasty virus that we never had any idea how, we don't even know how it operates half the time. You know, it's very different. And so people have to get used to living with it while it's here. I never want to give people the impression that a vaccine will be our cure-all and save-all. It won't. It will not. I have never in my life seen vaccine given to people where it wasn't tested on them first. So, I mean, right now the tests are happening on adults. So there's going to be this group 18 to 65 that might have access to a vaccine soon. But that won't be a cure-all and end-all, because we know that this virus behaves very differently. And it's not going to be like, you know, right now as it stands, it's not going to be like, you know, getting your tetanus shot and it's good for 10 years. It isn't like that. It may require a yearly shot, just like the flu vaccine. We don't know yet. So there's half of me that says, just shut it down, let us get it out of here. But then there's no guarantee this ugly bug won't circulate again in 3 months and we'll be right back to where we're at. So the plea is, please, we have to get people to stay home, learn to wear a mask, wash your hands, stay away from sick people, and for goodness sakes, don't have large gatherings in your home where you let your risk down. I mean, I think we have to think of this in the long haul. And the long haul is COVID, SARS-CoV-2 that creates COVID-19 is here. And we have to learn to deal with it, or we are going to be in this predicament for longer than we need to be.
Alicia, anything you want to add to that?
I agree with all what Commissioner Skoda has talked about this morning, and we don't have a crystal ball, but I think what's different now than what was at the beginning of this year is that we now have resources. When we had to shut down before, we didn't have PPE, we didn't have the business community as partners the way we do now, and I think that you all have stepped up. Have kept your employees safe. And the spread that we're seeing is really the spread of how to deal with this on a day-to-day basis in your personal lives. And I think that to the commissioner's point, we're going to have to figure out how to do things differently. We can still do things, but they need to be done differently. And we can't let our guard down, and we can't get around people that we trust, you know, because they don't know what they're carrying. And we really have to understand that it's not a trust and I don't trust you issue. It's I want you to be healthy. I want my grandma to be healthy. I want all of us to live through this. And so what we can do in our personal lives is going to be what keeps our businesses open, what keeps our schools open in the long haul. And I think that this county system that we've created in partnership with health departments across the state is really going to help us keep a temperature of what's going on where. But we really do need to continue to, I know we're fatigued. I know I'm tired of hearing about COVID-19.
Sure.
We really do need to continue the fight against this disease and not let our guards down so that we can be healthy and continue to push through this, because it's going to be a long haul,
Right.
but we can do it.
So another question that came in, maybe Alicia, what are the warning signs that employees are facing some sort of addiction? And if you start to suspect that or see that, what should an employer do?
That's a good question. I think that, you know, one of the things that, and I can share the tool, there's a tool out there that I came across in our partnership with the Nationwide Foundation, who gives you an idea of prevalence within your workforce. And it basically looks at your type of industry and what the basic prevalence numbers could look like in your type of industry, in your zip code, in your area. I think that what we know is 1 in 5 people struggle with a mental health and addiction issue at some point in their lifetime. So the reality is it's probably already in your business. At one, you know, extreme to another, or one level to another. You know, it doesn't mean that someone may be at risk for an overdose, but understand that they may be at risk. There may be some people at risk for an overdose. So looking at your health data, talking with your HR team, making sure EAP services are available, or if you don't have those type of services, understanding that they're, making open conversations with your HR department's opportunity will help you take a read on workplace health. And depending on your environment, I think one of the things that is true for all people is that the signs and symptoms are sometimes evident. If you see someone who has been, a joy to the office suddenly have a mood change and they're wearing all black and they seem sleepy all the time, and how are you doing? Asking questions and really having a conversation with them. To say you notice a change in them is not only good for understanding, what's going on in your workforce. It's also good for that person. Maybe they're dealing with the death of a loved one. Maybe they are struggling with depression or anxiety or something else. And so those signs and symptoms are usually visible. And that if folks know what to look for, they can see them.
With that being attentive at all levels of the organization to things that look a little bit different. Brent, anything you'd add to that? I know you've been coming in and on your connection, but are you, as an employer, anything that you'd add to that discussion?
Yeah, I would say that really look to see where somebody is. If you see a change in how they are approaching things, or they seem to be a little bit shorter or disengaged, that would be something. Look for absenteeism and times when somebody just is not showing up or is a little less responsible. Also look for workplace injuries. Many times that's how some of these problems show up, is through some of the injuries that take place as well. So these are some of the early signs for looking at your employees and trying to sort out some of the challenges that they may be having.
So as we finish up here today, ask you each for maybe 15 or 20 seconds of what's one thing that you think is super important for employers to take away today about the intersection of employee health and their business? I'll start with you, Alicia.
I think that, the importance of kind of keeping all of this in mind and being partners, not only in our communities, but we'll be partners with you from the state level is going to be important. Taking care of each other, knowing that we all are in this together, but maybe come from different boats or in this, big sea and are in different boats. I think it's just a good analogy to the fact that we all have a different perspective in this and are going to need different and varying levels of support to get through it together.
Great. Kyle, a thought that you want people to take away?
From an economics perspective, I think the health and quality of the workforce is the #1 determinant of growth in the local region.
Brent?
Yeah, I echo that. I think that there is an absolute connection to the success of the business as well as to the health of their employees. So you need to see that connection, and there are resources available to help you with that, and we've provided some of those today.
Commissioner Skoda, I'll give you the last word on it.
Okay, but I did think of one more resource and I forgot to tell you. I just wanted to tell folks, on our website is a link where you can report a positive case to us, because then we can identify outbreaks within organizations and help provide testing or supports to that business. But when you report that positive person to us, having an employee positive, automatically an email is generated to you with all kinds of resources about cleaning, supplies, PPE, what are your needs.
That's
so
great.
We send that to you automatically. So if you just go to our website, and it's up there, I think Greg put it up there. I mean, there's, if you put in there, just put in the employee, and then we email it automatically to you. And that's a big help.
Great.
In regards to knowing what to do when you have a positive employee. And so I can get that to you, Steve, and we can
That's
post
great.
it.
We'll
It's
get
just
that
our
out.
website. And then in regards to health, we have to take care of each other.
Yep.
I mean, that's the bottom line.
It's great, a great final thought for us this morning. So thanks to all of you, Dr. Pawlecki, Commissioner Skoda, Director Nelson, and Kyle. We all appreciate your insights today and what you brought to all of us. As employers, we have responsibilities in this space. We got to take care of our employees. I like the way you put that, Commissioner. And I think one of the things especially we're working on right now, as we've talked about COVID, is making sure that we get that message out for folks to mask up, for us to keep our businesses open. Our number one goal is to keep commerce going. For us to do that, we've got to take the steps that allow us to continue to operate. And as I think was said by the panel, find a way to operate in the midst of all this, because it's going to be around for a while, but it's up to all of us to take those individual actions. 2020 has been pretty challenging for all of us in lots of ways. We appreciate the comments you made today, regardless of how many employees you have. If you're a business of one, or you've got thousands of employees, that health and that wellness of the folks around you is going to not only accrue to their benefit, but to yours as the business owner as well. And there's something that we can all do to make it better here. So with that, I'd like to close by thanking each of you for participating in this discussion today. And thanks for all the time of our panelists in preparation for this. Our last session in the Leadership Dialogue series for this year will be the 2021 Economic Outlook. That's going to be on November 20th at 8 a.m. to 9:15, like these other series have been. During the event, we're going to talk about the economic forecast for 2021. We're going to talk about some trends that we're seeing locally and nationally in the economics, and also a little bit about the policy priorities and political implications for business as a result of the presidential election, which we think will be close to finished by then. So we're also going to put an intentional focus on a discussion around the importance of inclusive economic growth. So it'll be a great event. We've got some great panelists moderated by Brad Whitehead. We've got some folks from different economic development entities. We've got John Green, who's from the University of Akron, who's going to talk about politics. We've got Jacob from Team NEO in terms of research, and just a number of great folks to sort of add to the discussion there. So hopefully you can join us for that. You can register at our website for that. Thanks again, everybody. Have a great and a safe day, and enjoy your weekend.